the next session, which is citizen-powered technological enablement, and it's a panel debate looking at really the analog to digital switch. And we have a great lineup of speakers to address that question. And each of them is going to have 5 minutes. They're going to come to this lectern, and I'm going to start by introducing the speakers where they are, then invite the first to come up. So we have Phil Laws, who's the head of all IP at Openreach, and I would stress that's not British Telecom. We also have Karen Taylor, director of Deloitte Centre for Health Solutions, who's at Deloitte. And we have Helena Zaum I've got that wrong, haven't I? I knew I was going to struggle, my apologies, who is the local and regional government industry lead for Microsoft UK, and Steve Sadler, who's an associate with us at the TSA. So without further ado, I'm going to invite, I think in the order of the names on the paper, I'm going to invite Phil to come up and address us.
My name is Phil Laws, and I'm from Openreach. I actually lead on the withdrawal of the wholesale line rental portfolio, which is a result of the BT Group PSTN shutdown. So it's my job to ensure that everything moves from today's analogue network onto tomorrow's future fibre all IP network. Just to be clear in terms of who Openreach are, so we are the national local access provider, currently providing a whole stack of analogue services, as well as some of the more future-proof fibre services, moving up to the sort of bigger business solutions like Ethernet. My quick presentation this morning, I'm going to talk a bit about numbers and some dates and some significant changes. So, from an Openreach point of view, today we sell directly or indirectly to 650 communications providers in the UK. And we're engaging with them, or trying to engage with them, to make sure they're aware of the programme, they engage with us, they engage with their customers to make sure that everybody is aware and has plans to move onto the new network. In terms of that engagement so far, we get together every couple of months, and there's around about 30 CPs who turn up. So my question is, what are the other 620 doing? Do they know all about it and they don't need our help and assistance, or don't they know? So one of the issues that we're struggling with in terms of making sure that everybody is aware, it's the awareness, both in the communication providers and also the wider industry. So Openreach is on the road to a significant FTTP rollout, aspirations to deliver 15 million FTTP premises by the middle of the 2020s, subject to a number of enablers, both product regulation and some government issues as well. In terms of the PSTN switch-off, so hopefully everybody knows that at the end of 2025, the public switch telephone network as we know it today will be closed down. A stop sell has been introduced for WLR analog and ISDN services from September 2023, and from that point on, can't order any more of those services. There's around about 15 million lines and channels of WLR services out there today, and with an end date of 2025, that's a migration rate of around about 50,000 migrations of lines and channels per week, every week, from now to the end of the programme. That isn't happening. So there's an issue out there in terms of making sure people are engaged and they do something, which is one of the reasons why I'm here today. In terms of making it real, we've announced there'll be 2 trials that we're going to run in the UK. One is in Salisbury, and that's about the move to an all FTTP network. So Salisbury is the first contiguous FTTP build that we've initiated in the UK, and the stop sell for Salisbury for the old products will be broadly this time next year, December 2020. In Mildenhall and Suffolk, it's a movement to what we're calling single order products. That's primarily the fibre to the cabinet based technologies. And there'll be a stop seller from those in May 2021. The end of the trials is the end of 2022. The key point is it's happening, it's real, and if people want to operate in those areas, they'll have to make some changes. I'm pleased in terms of talking with some of the exhibitors today that they are aware of some of the dates, which is really good. I'm very pleased about that. In terms of special services, so we call over-the-top systems and special CP that connects to the end of our network, special services, we're going to put a test lab in place around about the Q1 next calendar year, where CPs can install their networks, third parties can come along and do some testing to make sure that equipment does work on these future access technologies. Listen out for that. The other point is, I'm very motivated in terms of actually migrating a customer who is vulnerable. So what happens if we Openreach know that a customer is vulnerable? What do we do when we do that migration? Secondly, if we go to someone's house not knowing they're vulnerable, do our work, and then actually see they're sat there with a health pendant around their neck, what do we do? And we're working very closely with some of the TSA leads who join our industry forums, and their job is to ensure that we as a community are actually aware of some of the issues and concerns, and actually taking your thoughts into that forum to make sure action is taken. And I'm not sure if Tim Muller is in the room, but Tim's the lead from a TSA point of view, working very closely with him, and we really do appreciate his support. I'll also say that in our industry forums, anybody's welcome to join those. It's not just about communication providers. If anyone else wants to come and join those to educate people in terms of what's happening, what the requirements are, and actually helping to define, for example, what our special services test lab is, they're more than welcome to join, and please come and talk to me after the session. Thank you.
I invite Karen to make her way to the lectern as well.
Good morning. As I was introduced, I run an independent research hub in Deloitte called the Centre for Health Solutions. And our mission is largely to curate all that information, policy, documents, and other research, academic and other research that's out there, and share it with people who haven't got the time to read it themselves. But importantly, with a name like the Centre for Health Solutions, look for the solutions. Healthcare and social care are facing many, many challenges, but someone somewhere has identified a solution to those challenges, and that's what we try and find those solutions and share it. What I want to just quickly share in this 5 minutes with you is a brief overview of a report that we published earlier this year, looking at closing the digital gap. It was focused on the NHS, so it's looking at all different sectors of the NHS and all 4 countries in the UK to understand where we were today in terms of that journey towards a more digital future. The NHS long-term plan makes a big play for digital transformation and sees digital transformation and designing services around the patient as being the future of healthcare and social care, because at the heart of it is integrated care systems. And that move towards a more population health-based approach, prevention, and all of those things that I'm sure you've talked about over the last day and a half. So we wanted to know where we were. So we asked 1,500 staff, frontline members of staff in the NHS, what they thought about digital transformation today. And as you can see from this Wordle, it wasn't particularly positive. In fact, the negative sentiment far outweighed the positive, with slow, expensive, challenging, disjointed being some of the most predominant words mentioned. There were some positives, but as I say, were mostly outweighed. We also asked what the barriers were. The cost of technology was a significant barrier, so was finding the right technologies, which I'm sure all of you have experienced, because there is so much out there. You just have to walk around the halls today to see all the different support technology that's available for maintaining people's independence in their homes, which, as we know, is what people want, but also the complexity of the technology, which makes people question whether to adopt it. So those are the 3 most mentioned barriers. But we interviewed 65 leaders across the healthcare system, and they identified funding, leadership, and interoperability as their main challenges. The types of technology that people are using, the electronic health record was identified as the most well-known, the one that they were using, the one that they thought would help improve the efficiency and effectiveness of care. But as soon as you start going down that list from e-prescribing, point-of-care diagnostics, to the more novel technologies, robotics, which we heard about just before the break, radio frequency identification, virtual reality, and importantly, artificial intelligence, very, very limited awareness and use of those. In a way, for artificial intelligence, it's not surprising because it's not something you see, it's not a tool in itself, but many, many of the digital technologies that are being, and tools that are being developed do have a layer of artificial intelligence embedded in them in order to make the best use of the data that these technologies can collect. And that's what digital transformation is about. It's about making better use of data and information, ensuring it's in the right place at the right time for the people who need to use it to improve care, the efficiency and effectiveness of care. We identified these 5 key steps to choosing the right, to closing the digital gap, which, by the way, I haven't got time to go into, but the gap is significant. In terms of maturity of hospitals in digitalisation, the range is from 18 out of 100 score to 96. So a wide gap in digital maturity, which, unless it's tackled, is not going to help meet the visions in the long-term plan. But these are the steps. The infrastructure, getting that right, including connectivity and Wi-Fi, which there has been an initiative to roll that out to GP surgeries and hospitals. Open electronic health records so that people can access it and share that information. Interoperability, a very key challenge, arguably the biggest challenge. Unless the technologies can interoperate with the data systems, with the electronic health records, then those technologies will just be nice to have rather than really making a difference. Importance of governance and changing mindset if you're going to adopt technology as part of your strategy for improving care, for bridging the gap between the demand for services and supply, and finally, the leadership. This just gives you what I've just said about the digital maturity gap. And we identified the need for technologies, and I think this is true whether we're talking about healthcare or social care, to be smart, to be straightforward and easy to use, to be able to have a measurable impact. If you want people to buy your technologies, you have to demonstrate the impact it can have. To be agile, with technology, the quality improving all the time, with new add-ons happening religiously all the time, we need to be able to have agile technology and know that the technology you buy today won't be out of date tomorrow. Reliant on industry collaboration, which is why everyone's here today, I'm assuming, because we can't do it on our own. Nobody, whether in the social care, in the healthcare, or private sector, or in the industry, can do it on their own. It needs partnerships and collaborations. And then finally, the most important, arguably, tailored to end users' needs. If it hasn't been developed with the end users' involvement, then the chances of it succeeding and being adopted at scale are much more remote. We asked what 3 words came to mind when they thought about where they hoped the digitalisation agenda would be in 5 years' time. And as you can see, the sentiment here is much, much more positive. Efficient, effective, safe, reliable, integrated, fast. So there is real belief that digital solutions can help deliver the vision for a brighter future with care designed around the patients. But let's not forget, the world is changing rapidly. The future of healthcare is going to be very different. It's going to be more about prevention. It's going to be more about personalization. And we tend to think of in terms of linear progression, but actually it's exponential. And some of these technologies that are up there, nanotechnology, artificial intelligence, 3D printing, are all a reality today and are fast being adopted. So I'll leave you with those thoughts and happy to answer any questions.
Thank you very much, Karen, and now for Helena.
Lovely. Thanks very much, Paul. So I just want to share a few thoughts with you, really, as you start to think about how you might scale up the work that you do already with digital. And the first point that I really want to make is all about the importance of data. We've heard some really wonderful stories over the past days about the importance of personalisation and thinking about really how the individual should be at the heart of the system that we are seeking to reform and push forward. And I really think that data is absolutely fundamental to the idea of being able to deliver a personalised service. You need to understand what's happening for a person not only in real time, so the information that's being provided perhaps by your technology-enabled care landscape, but also to have a view about what's happening for them in terms of their housing, in terms of the broader ecosystem, and of course in terms of their family and friends and people who can respond to their needs. So I think that we really need to be pushing for a data-driven service provision. In order to do that, I think it's absolutely critical as you think about the digital switchover and you think about new models of care, that each organisation thinks very carefully about having a data and AI strategy. AI, has lots and lots of explanations. I think sometimes it's helpful to think about it as assistive intelligence, especially in this space. But the reality is we will live in a world, and we already do live in a world, certainly in a consumer world, of tremendous proliferation of data, and we as humans are not really very good at sifting through it, but computers can be, and they can really, really support us in doing that. I think your data and AI strategy should have two main components to it. One is obviously around the business drivers and the business needs, and I'd really encourage you, as you think about scaling out, to be very specific about what it is that you're looking to achieve. I think if you do this well, you will get your organisation ready for future devices and future changes. I think we'll see nothing but proliferation in terms of the devices and how smart those devices are. But I think it's very important to be specific about the problems that you're looking to fix for the people who live in your area. Let's be very specific about problems. So, if people are falling, who's falling? When are they falling? What are the early indications that that might be happening? And naturally, there'll be an important technology component to that as well. And I think Steve's going to talk to us a little bit about the joyful topic of cyber and information governance. So I shall respectfully leave that to him. So the second way that I think you need to think about accelerating and getting to scale faster is not to think about any of this as a technology project. This is absolutely about business change, potentially system-wide business change, and slight plug for a forthcoming session, but I'm delighted to be joining Nikki Parker from Manchester, who's going to share a little bit about the work that they're doing, thinking about system-wide change and how care can be delivered more effectively for the people of Manchester. So do join us, because she's got some great real-life examples to share. But business change, all about, of course, new ways of working, about new organisational design and vision, very importantly about culture, and Karen's already mentioned governance and leadership. So, we need to think about this in very, very substantial terms. This is not just a small technology project. Last but by no means least, if we're all going to get ready and get practitioners and indeed citizens ready for this new world, we need to be thinking about new skills, new qualifications, and data literacy. We will be operating in a world where suppliers like Microsoft and others will be suggesting that we make use of tools like AI. And as practitioners and commissioners, we need to be clear on what exactly is happening in the AI. We need to be able to challenge suppliers about their business models, and we need to be able to understand exactly what decision support we're getting from these new tools. We also, of course, need to make sure that carers, citizens, people involved in the system have the right digital skills to be able to contend with the new and very exciting world that we have before us. So I hope that you'll all be bold. I think the opportunity is very substantial for people. I think it's substantial for the system as well, and very excited to begin the conversation with you all.
Finally, introducing Steve, who will be talking to us about the role of cybersecurity, I think, amongst other things.
Good afternoon, all. It sounds a bit dry and dusty, doesn't it? Data and cybersecurity, and I'm not really going to talk about that at all, as we'll see in a minute. Well, I am and I'm not. So let me explain. A lot of my interest in the last few years has been the whole issue around digital shift or digital transformation, and Phil's already talked to some of the drivers behind that. And the conversations are starting to move. So I'm an associate with TSA, and we go to lots of working sessions with lots of you. I'd like to just play back a summary of some recent research, if I may, because the question I want to address here is our readiness as a sector for that change. So as we work through these sessions, we're finding the conversation changing much more towards, okay, yes, there's a disruption, there's some digital shift, but what are we actually going to do with that digital world? The data, what data? Why? How are we going to enable more proactive services? And you've already heard some thoughts on that from Karen and Helena. But there's also a set of questions around our readiness. So I just want to give you feedback from a study we completed a few months ago. It's quite intensive. This was sponsored by the local government association on behalf of Health and Social Care and Downing Street. And we were asked to look just at the technology-enabled care sector. In other words, we here today. And I would say thank you, because many of the people who engaged in the research are actually here today as well. We had to come up with quite a large research sector. We had to cover 10% of the entire market of service providers. And whilst this talk is labelled data and cybersecurity, the piece of research, the engagement with the service providers was very intensive and ranged right the way from workforce issues, even physical access to buildings and storage of information, right the way through to how do you configure firewalls and all that more dry and dusty IT world. So it was a very far-reaching study. And what came out in terms of set of conclusions was quite intriguing for me. So this is all about, are we ready? Three major themes came out, and I don't think these will necessarily surprise you. When you looked at the distinction between the different service and technology providers, the three characteristics that made them look and feel very different were the digital maturity of the organisation. That's pretty obvious, isn't it? But actually, there were some surprises in there. The LGA were, for example, quite perplexed that only 33% of the organisations we met were even aware of something called the Cyber Essentials Toolkit. So that's a problem we've all got in terms of communicating what good guidance is out there. So maturity was one issue. A lot of the organisations were relatively small, very focused on care, as they should be, and didn't necessarily have the level of investment necessary to have a range of staff around them to support all these sort of issues. So the level of investment in all things to do with IT and security and data protection was also a big variable in this. That was the second one. The other one that had a big impact on people's awareness and capabilities was just the scale and the breadth of services. I guess almost predictably the bigger ones had more back office resource to help them navigate. But I guess what really stuck in my mind was the variation in those services. We asked hundreds of questions and worked through lots of hours of detailed sessions across those characteristics we talked about. I think they were grouped in 14 categories of question types. It doesn't really matter. But it allowed us to rank the organisations. We could do a red, amber, green assessment of readiness. And this was all anonymised. This was almost a diagnostic for the organisations to take away and build on. But 32% of the organisations came out red, as in there were some significant failings, were not ready for anything that looked and felt digital. 37% were amber, and only less than a third, 31%, were in that green category. That kind of surprised us. We expected a variation, but maybe not that stark. The biggest risk areas that came out of all this across the categories were basic systems and processes. It's not necessarily IT, but the way we and our staff manage activity and work through processes, even up to and including opening or not opening suspicious email activity. So systems and processes, basic network security was highlighted as a concern, and that one's kind of unforgivable. We've got all the IT tools in the world to deploy protective measures, antivirus kits, firewalls, and so on, but it was still a big issue. And technology management, and this might be an area that's of quite a big concern to us as we go forward. If you look at that oncoming digital world, what technology meant was our ability to acquire the right technology, manage it, maintain and refresh the state of software and operating systems, just keeping things fresh. And in an older-fashioned analog world, maybe that's not so risky. Those devices out in the field don't tend to get refreshed, but the digital ones do. So unless we've got processes to stay abreast of the game, then we might have a problem. So huge variation in our maturity. That led to some quite heavyweight recommendations that came out of the LGA supported report. So I'll just quickly, I think there were 6 that really stick in my mind. One obvious one is we need to do more to learn from digital switchover, internationally in the tech sector, but also in adjacent sectors. Let's not try and solve the problem ourselves. There was a big push to, as we make this change, to strengthen the whole issue of interoperability and information sharing, because that digital world gives us access to better and more information, and people want to consume it. It needs to go somewhere. So that led to a very strong recommendation that we need to work much closely with Department of Health, NHSX, NHS Digital, and not create isolated TSA or tech sector initiatives. And a very strong hit for TSA was we were asked to go away and revisit our regulatory and standards content, things like the Quality Standards Framework, to make that piece around protecting data and cybersecurity explicit in our protective measures. We were also asked to look at encouraging commissioners to include explicit reference and requirements to protection of data and cybersecurity in their procurement. And last but not least, and maybe a more positive one, they made a strong recommendation for Department of Health and Social Care and their associated body like NHSX to help us in this commissioning of the change and the tools we need, the support we need as a tech sector. So relatively surprising and some fairly hard-hitting recommendations. Maybe I'll stop at that and take questions later. Thank you.
Great, thank you very much. So this is again the opportunity to use the app. We've already had a few questions that have come in, but if you turn to the app and look for the agenda item for this panel discussion, and then just go to the bottom of the page and click on Q&A, you can type in your questions there. I will also be coming into the audience, not literally, but inviting you to come up with any questions you might want to ask from the floor, and I'll look for hands in a minute if that is helpful. I'm also going to ask the panel. You might each have a question you want to ask someone else on the panel, both to challenge a little bit, but also to elucidate a little bit. So in a few minutes, I'm going to ask each of you if you've got a question for someone else. And don't use it as a way of saying something else that's really is a statement, but just a question to sort of help move this forward. So the first question we've had actually is a question for Phil, and it's how will we know when our area will be affected by the changes?
Thank you. So the approach we're taking in the UK is, whilst we have a national programme, it'll be communication provider driven. So we are working with all the service providers, communication providers, and we'll be expecting them to provide migration plans. So it's not going to be an exchange by exchange switch off. It'll be elective through the communication providers that serve in the various areas. Some CPs are national, some CPs are literally one-man bands who only operate in individual exchange areas. So it's not going to be exchange by exchange, it'll be elective through the communications provider.
So because this is a mixed audience in terms of what they're understanding, and I would include myself as being a very low ability when it comes to my understanding of the answer you've just given, could you translate that into something that a member of the public walking down the street here in Birmingham would understand? How would they know when the digital switchover is coming to their neighbourhood?
So broadly, each consumer and business, it is not just a consumer thing, it's everybody's impacted. And it's worthwhile pointing out that, I don't know how many people in the room, but broadly 90% plus of every single person in this room will be impacted in their private life and in their business life. That's broadly the scale of the problem. What Openreach want communication providers to do is to engage with their customers to make sure they are aware of what's happening and the plan that the communication providers have to take those customers through a migration. So it's not something that will be directive by Openreach. It'll be a communication provider driven thing. So whoever supplies your services today, they will come to you at some point and say, dear Mr. So-and-so, the telephone network is closing down. All IP is a great story for the future. You can do some wonderful things, and our proposal is to migrate you on a date that suits yourself, and an appointment will be made.
Okay, so just one, I'm going to come to Steve actually. With Steve, you attend a lot of the meetings with the infrastructure providers, the discussions around the digital switch over. Can you elucidate what you've heard from those organisations that Phil has just referred to as what they are saying to you and what we're saying back to the industry at the moment?
I think we're getting slightly different responses from the different communication providers. So in other words, the companies that we as consumers engage with, there's no way around this other than to engage with that provider. Certainly we're seeing statements recently from Virgin Media, for example, trying to be helpful by doing some testing later this year. And people are starting to publish information about geography and about timescales, but we don't have a full story yet. So we've got representation on various working groups with the communications providers and Ofcom. In fact, Tim at the back there is on one of those groups. So our job is to push away at that, and as soon as we have clear information, we'll help communicate that too. But as yet, it's not at that level of detail as far as I can see. Is that fair?
It is fair, and that's, as I mentioned in my little talk, it is a concern for us. The one thing we are going to do in the trials, in the 2 trial areas I mentioned, is that Openreach will lead on a public awareness exercise. That's not something we normally do. We engage through service providers. That's the way we operate. We don't think the way it's currently working with communication providers is quick enough, it's not bold enough, and we want to make sure that everybody in those exchange areas knows what's happening. They know who to talk to, to expect a call or letter from their service provider, what they should do with it. And if there's any doubt in terms of the legitimacy of someone talking to them, Openreach will also have a public website that people can be referred to that will tell them in detail about what's going on and why.
Thank you. Just moving on to a sort of one of the sort of themes that came out very strongly, I think, from all 4 presentations was this level of readiness for the shift and the level of maturity to actually embrace and engage and adopt the technologies that might be enabled by that shift to digital. And Karen, in your presentation, you gave us some of the sort of steps to the ladder you set out as being part of that. What would you say to an audience that which is a mixture of commissioners from local authorities, manufacturers and providers of services in this space? What are the things they particularly need to be thinking about now? And I'm going to come and ask the same question of Helena as well, to help them accelerate their pace towards maturity and readiness for this, both the switch, but also the potential opportunity that then arises from the switch.
I mean, it is different things for the position that different people are in. And obviously, if you're talking about a hospital with who has to have an electronic patient record and have that connected to devices, whether it's the radiography imaging or pathology results, whatever, their challenge in becoming digitally mature is a lot more difficult and complex than a smaller organisation who may be just going down the digital route and needing to ensure that their technologies that they're adopting have been meets data standards, interoperability standards, specifications. And when you're working with a provider, a supplier, ensuring that the contracts specify the standards that you expect them to maintain. We did do a survey of medtech companies for another report called Medtech and the Internet of Medical Things. And a lot of the medical technology companies who responded felt quite confident that they were protected from cybersecurity issues and that they were maintaining the standards. But when you probed, they didn't actually think that they would be responsible for anything, that actually it's whoever buys their products would then have to make sure that they would protect the data was protected. That can't be the right answer. It has to be a partnership. You have to make sure the contract specifies it and that the supplier actually can demonstrate that they are compliant with standards, in particular things like interoperability standards. There isn't a single one at the moment, but more and more are adopting the HL7 HIR standards, and particularly if you want to supply into America, you've got to be able to maintain to those standards.
Thank you. Helen.
And yeah, I mean, I think it's really, really important with your technology that you stay as current as you can. You know, we've all heard a great deal about the cloud and about software delivered as a service. There are some issues with that in terms of access to data, and we spend quite a lot of time talking to suppliers saying, actually, please don't lock the data away. Just because your customer doesn't know they might want it today doesn't mean that they might not need it tomorrow. So I think that's very important. Some of the benefits, however, of consuming software as a service is that naturally the onus on staying current, staying safe from a cyber point of view is quite squarely with the provider of that software. And in a way, it takes a bit of a headache away from the organisation that is consuming or using that technology. But I think one of the areas that we're most interested in actually is I suppose, igniting the passion from the point of view of practitioners, carers and citizens. I don't think we should just be making this move because we will soon have no choice because the switchover's coming. The opportunities are very, very substantial to deliver a more efficient and a more personalised service. So I think we really, really need to go after that today. But that means that each of us need to become learners of this industrial revolution that's happening. There are papers a go-go. Karen's obviously produced a load, we produce loads, got loads of free training and things. I think the world that we live in now requires us all to really, really stay apace as to what's going on behalf of our organisations and the people that we serve. So I think it's about a personal shift as much as anything else.
I think that's an interesting sort of challenge to leaders in this room, and the point that was made yesterday is that regardless of where you are in the organisation, you can still be a leader of change. And I think, therefore, the whole piece around CPD and workforce development being a key part of what we've been talking about. And I think the point about data, point that we heard made several times yesterday, is that predictive modelling is going to be that much better dependent on the amount of past data you have.
Yeah.
The more you have of the past, the better you're going to be about predicting the future. I think
Absolutely.
that's a really...
You need substantial amounts of data in order to really make the most of the AI opportunity. That's for sure.
So Steve, we've heard, if you like, some of those issues about maturity and readiness and if you like, being open and engaged to the learning that's necessary to make this shift not just something which is a burden, but actually is an opportunity. What sort of role could the tech quality and the QSF and the sort of quality improvement approach that play in supporting this sector?
So I'm guessing, to me, one way to play that question back is if you think about everything we're doing in our sector, we're trying to provide support and services to some of the most vulnerable people in society. And they're arguably the most easy group of people to fall off the cliff into more intensive health and care services. And we've got to find a way of working cooperatively with those other services to either ease those transitions or prevent them. And one of the big questions that keeps coming up in our workshops are things like, in fact, maybe we could pass this question back to Helena and Karen in a minute, the issue of information sharing. If we are day by day potentially in contact with the most vulnerable citizens, surely we can do more with what we have. We can gather information, we can share it. If only we can break down some of the information governance barriers. And I was maybe going to ask for observations on whether that's still an obstacle or whether there's more we can do. Certainly within TSA, we've set programs of work in train to look at exactly these issues. What sort of proactive services, how do we protect the data, how do we exploit and use that data and so on. So we're going to see lots more. In fact, coming months we're going to see some very interesting ventures on that. But I would like to just explore that.
You're taking your opportunity to exercise your one question to
it
others
probably is
others
actually.
on the panel.
Are we still seeing obstacles to sharing information between, particularly our sector, into social care, housing, and then into health? Okay. Do we have an easy solution to that these days?
I think there's an easy answer, which is yes, we see problems sharing data, but I think half of the problems are man-made. We're putting barriers in place that don't need to be there. Some organisations have taken compliance with the GDPR, so General Data Protection Regulations, as an opportunity to really look at how they use data, store data, share data, and find that provided they're compliant with the GDPR, actually opens up lots of other opportunities for them. So I go back to a point I made. Someone somewhere has found a solution to whatever that problem is, and it's identifying and understanding how that they were able to do it. Ultimately, it's about ensuring that the data owner is satisfied that the data is being shared and how it's being shared and for what purposes. And that sounds a bit complex if you're thinking about the millions of patients or citizens who you're caring for, but actually there are straightforward ways of doing it, and I just look at who's doing it well and learn from the best. And some of you mentioned Manchester later. I mean, Manchester's addressing a lot of these problems in trying to integrate all its services. So, as I say, the answers are out there. It's just finding them.
Yes.
I think, technically information sharing, kind of couldn't be easier. There are a million ways of doing it, obviously. There's clearly a very important role for individuals, as Karen said, to, in the permissioning. I think, areas which have a reasonably mature LICRA are some way down this journey. I'd also call out the northeast of England, actually.
Yeah.
I think some really, really good work going on there. So I think we do have some experience, but, a perennial challenge, I think, is, people are under pressure. Time to share detail is not necessarily something many organisations have.
Yeah, I think that's a really important message in terms of the role that you play, but also the role that TSA can play in actually helping to make sure we're not reinventing the wheel multiple times, that we are sharing what we know around best practice. I'm going to go in a moment to the audience to see if there are any questions, so be ready to put your hands up. There are people with microphones and numbered placards to assist us with that. But I was just going to come to Phil very quickly and ask a question that I've had on the system here. Can you please advise on testing of existing equipment and whether each CP is supporting to a suitable level?
So I mentioned earlier on that the engagement we have with all the CPs we supply to is not great across the board. So the very big CPs that operate in the UK, they are engaged, which is really good. I'm aware that BT Group have got their own test lab over at their research laboratories. And I'm also aware that Virgin Media have their own test lab as well. And they're also customers of ours. So what we are trying to do is set up an open-reach test lab where any CP can install their access lines from a fibre point of view, Ethernet point of view, as well as some of the existing lines to do with the interworking testing as well. So I've had a few conversations with people today about that. The objective is to do as best we can to get all CP's access networks into one place so that the equipment manufacturers and over-the-top suppliers can come and do the testing on each of the CP's networks in turn, as opposed to an ad hoc type arrangement darting all around the UK. So the intention is one location in London. To date, the engagement's not been great, but I've got one of the large CPs, who I won't name names, who've offered to actually help with that engagement to drive industry to come together with a set of requirements so we can formalise that and get the building in place.
And this sort of interworkability piece is something I know, Steve, you've talked about in terms of some of the sort of single testing offers that are out there at the moment won't necessarily uncover what happens when you're then running across multiple different providers. Steve, do you want to just say something on that?
I'm really encouraged by what Phil says there. One of our concerns was the original brief we got from the communications providers and Ofcom was that one of the risks around this communication is not so much within a network. I'm sure BT are more than competent to plug a device in one end and we'll get the right information out the other. What was speculated was it was when you migrate between one communication provider and another. And we're told that if you ran an alarm from a home situation to a remote monitoring centre, you could traverse 6 different providers, for example. So it was looking at those boundaries. So to hear that there's going to be interoperable, interworking testing is great news.
Right, I'm just going to go to the audience, then I'm going to come to the other panellists who've not yet had their chance to ask a question as well. So any questions from the audience? I can't see hands at the moment, but the lights are quite bright, so I may be missing one. No? It's another one of those tumbleweed moments where the chair asks the question, is there any questions, and there aren't any. So whilst you're...
Paul, I think there was a gentleman who was thinking about it.
There is a hand. Yes, sir. Thank you very much, sir.
Hesitant,
I'll help you out, yeah.
Thank you very much.
No problem. So just the gentleman from OpenReach there obviously given us an explanation about testing equipment across networks and building that facility. With that in mind, and I think you mentioned the date of 2022 by the time you've set up some of the facilities, with that in mind, in collaboration with the message that some of the communication providers are starting to switch overs in test areas now, how does that line up, just for my understanding?
So there may be some confusion in terms of the date. So the intention is the test lab will be up and running in the first quarter of next year. The trials, which will start at the back end of next year and just into the start of 2021, they will conclude by the end of 2022. So from the end of the first quarter in the next calendar year, people come in and do their testing from that point.
Any others? Has that stimulated any other appetite to ask any questions?
Oh, as some ladies waving
You've got
at
a
the
much
back.
better eyesight than I have. That's brilliant. Okay, making
Apparently
our colleague run as well, which is great.
I did see those waving. I couldn't miss them really.
Okay, so the panelists are going to keep their eye out on the audience and spot the people that are waving that I'm not seeing. Okay, fire away.
Hi there. We're raising the awareness within the sector about the transition. But I just wondered if there's any information about coverage for the general public and raising communication awareness for them.
Do you want to start the response on that, Steve, and then I'll come to Phil?
Did I get the question right?
So I think was the question really about provision of information to the public, so the public know what to do and when things might happen? Is that what it was? Yeah.
So the only piece of the consumer communication that I'm aware of is that there are various groups. There's an Ofcom group which is specifically focused on communicating with the consumer, and they're working through at the moment various communication channels. They're by no means complete, and I don't think we as individuals have seen that information as yet. You may have seen sample information from some of the communication providers. So I think that's still work in progress. I'm kind of looking at Tim next. I think he was at the last meeting. Are you aware of any change in the information set from Ofcom on the consumer communication?
No, it's an issue that comes up at the regular meetings and really a debate. So Phil alluded to it before, that OpenReach have actually kind of stepped in and sort of kicked off some of that sort of end user communication by providing sort of easy to view videos on the website and things like that about what the changes are and how they're coming. But at the moment, I don't think there's anything concrete in place necessarily from any of the main providers about communicating.
So sorry, I think the answer is it's still work in progress.
Yeah.
So
Phil.
just one additional thing is that the broadband stakeholder group, I'm not sure they volunteered or were asked by Ofcom, but they are initiating some work to help educate consumers and small businesses in terms of their definition. We are working with them to ensure that the messaging is appropriate. One of the concerns I've got, though, is that their first step, which is a great first step, is they're going to create a website where people can go to. Now, thinking about vulnerable customers, they might not even know what a website is, let alone the fact they're going to need to navigate to it. So that will, I think, address some of the needs, but as Tim mentioned, and going back to my earlier point, from a trial perspective, we will do public awareness, in the streets, in the two exchange areas, Salisbury and Mildenhall. I'm not quite sure what form that will take yet, but things like town hall meetings, parish council meetings, leaflet drops, presence in market squares, that sort of thing. That's the sort of thing that we're looking at to try and make sure people are aware of what's happening. Okay, well, that's interesting to hear, and we'd be interested to see how we build onto that as well going forward. One of the questions I had was about particularly the impact of the switch over on older people and their lifeline and other services. And I'm not going to throw it at you as a question now, other than I think it's one of the anxieties. We're talking about potentially vulnerable populations who may not necessarily have access to the information and be as prepared for the switch as others. So I'm going to come to Helena to ask a question of someone else on the panel. Helena.
Lovely. Okay. Well, I've brewed a few, but I think, Karen, I'm going to put you on the spot, if I may. You obviously consume a lot of information, do a lot of your own research, and gather lots of information from, I guess, all over the world. And what do you think health and care will look like in 10 years' time? I know you're really grateful for that question.
No, it's a good question. We did produce a report called Predictions 2022, and I was only looking at it the other day, and it has, patients becoming more like consumers. Now, patients don't like being called consumers. They don't like to think of themselves as having a choice over what healthcare or social care they need. But actually, increasingly, they are making choices, and they are more informed, and as we go forward over the next few years, and certainly within 10 years, we will know so much more about our own health, our own genomics, our own risks, and the sort of behaviours we need to take. And we heard from the presentation this morning about how important sleep is, how important exercise is, how important diet is. We all know that now. Whether we act on it, I don't know. But as we move forward, healthcare systems, in order to manage the demand, are going to have to support people to take those actions to improve their own health and well-being. I see it in the younger generation already. I think they are living healthier lives on the whole, although we still have some challenges. We do have a platform which we call the Future of Health, and it's based in 2040, so it's 20 years ahead. I've tried to discuss that with people in NHS England, in NHS Health Education England, because if we don't start planning for what is possible because of our increasing knowledge of science and technology today, then we will not be able to have a sustainable health and care system. And so it's anticipating what's coming next, and I think you mentioned it in your presentation as well, and understanding where the direction is and making the change now, not waiting for things that will come 4 or 5 years down the line, but starting to plan and make those changes. And the move towards population health management. So in a very short answer, I'd say it's 4P medicine: preventative, predictive, participatory, and I can't remember the 4th P. But you can all suggest. In fact, I decided there was a 5th P, which is partnerships. It's all about partnership working.
And is there personalisation somewhere in there?
There is. That's the other one.
The other one. Have you? This is going to be the last question, I'm afraid. But have you got a question for anyone else on the panel?
I'll ask one to all of them.
Okay.
What one thing would you do differently now to actually use technology to bridge that demand-supply gap?
Great question. Let's start with Steve.
I just love to break down that barrier between some of the normal technologies I use in my life, the wearables and devices I play with, and the more formal healthcare systems. I just think there's such a great opportunity if you can link those currently separable worlds together. It's an easy thing to say and an enormous task, I know, but I would love to see breakdown of that barrier.
Yeah.
Helena.
I think we all need to get our data act together. I think if we can actually sort out the way that we use data from technology-enabled care and everywhere else, then actually we will be able to do a better job of applying very scarce resources to where they're most needed in the system.
Thank you. Phil?
I guess my take would be, but not forget those customers who aren't broadband savvy. They're simply users of what we used to call landlines with clever bits of equipment connected to them, to ensure that we don't just assume everyone is tech savvy, tech literate. And also, one of the concerns I mentioned earlier on actually is this question about how migrations are performed, how you take an end customer who is vulnerable from what they have today to what they're going to have tomorrow. How do you make that a sort of a worthwhile experience, and they're left no worse off, hopefully better off, when you've done the work.
Thank you so much. And would you like to answer your own question, Karen?
I think there's something about not seeing this as a technology problem and solution, but a different way of working. At the moment, people get 15 minutes of social care, or you manage to get an appointment with a doctor or a consultant for 5 minutes. Yet your healthcare needs are 24/7, your needs are 24/7. So being able to see this change in ways of working to support you to be able to communicate or understand at any point in time what is happening and what you can do about it.
Brilliant. That's a great place to end in terms of that ambition to see the whole person, not just the 15-minute dicing up of their lives. I think it was really helpful. Thank you very much. Can we show our appreciation to the panel? Some really great answers. Thank you very much. So we're now going to let the panel elegantly exit the stage, and then we're going to move on to our final session.